Now, as far as lumbar disc replacement, the ideal candidate is somebody who presents with debilitating back pain, often with leg pain, but not always. In the lumbar spine, the disc replacement can be done at 1 or 2 levels. Not all insurance carriers are approving 2 levels, so there are some individual considerations there. With the lumbar spine, we do come in from the front. And so with that being said, some of the reasons you might not be a candidate are if there's been extensive abdominal surgery previously, such that scarring might prevent us from safely getting to the front of your spine. Patients who have an excess amount of weight also would not be a good candidate for a disc replacement in the low back until or unless they lost weight. Again, based upon just the safety of getting to the spine from the front, because of the fact that we have to work around the big vessels, the intra-abdominal organs, things that have to get moved out of the way. We want to make sure that we can safely access the spine. Bone density is also a really big consideration. We have to make sure that your bone density is normal because we're relying on putting a metal and plastic device between the bones under the loads of our everyday life. If your bone quality is not good, then that implant could sink into the bone or fracture, and therefore you would not be a candidate for disc replacement. So we check that with a test called a bone density study or a DEXA scan. As I mentioned with the cervical spine, if there's extreme degenerative change where you have almost bone-on-bone collapse, lots of bone spurs, and the spinal level is already trying to fuse, it may not be amenable to recorrecting and restoring motion. And then lastly, a couple of the other big contraindications are instability. So if you have slippage of one bone on another, whether it's because of just degenerative changes or even a fracture, or if you have a severe scoliosis or a spinal deformity, these are things that might exclude you from being a candidate.